Ever feel like just keeping up with healthcare is getting, well, complicated? So much going on.
It really is. There's so many layers.
Yeah. So for this deep dive, we want to cut through some of that. We're exploring a really key area, how healthcare organizations aim for top quality and safety.
And crucially, the role digital tools are playing in that whole effort now. It's becoming massive.
Exactly. We've pulled together some really interesting sources for you. We'll be looking at Joint Commission International JCI, big global player in standards.
And also the National Accreditation Board for Hospitals and Healthcare Providers, NABH, which is focused on India.
Right. And then there's the tech side, digital quality platforms, DQPs. We'll get into what those are.
Plus insights from healthcare consultancies and groups like ISQA, the International Society for Quality in Healthcare.
So our mission today really is to understand the systems, the processes that hospitals and clinics use to show they're providing high-level care.
And especially how tech is becoming, well, almost essential to make that happen effectively.
Yeah. Whether you're working in healthcare, just curious about the system, or, interested in quality and safety personally, we think this will be valuable.
Definitely.
Okay, so let's start with the foundation, accreditation. These organizations setting the benchmarks.
Good place to start. Let's talk about JCI First Joint Commission International. They've been at this for over 2 decades now.
Wow. Dang.
Yeah, and they're widely seen as a global leader in healthcare quality and, really importantly, patient safety. Their mission is pretty clear.
Which is?
To enable and sort of validate the highest possible standards for healthcare organizations everywhere.
And their reach is huge, isn't it? I saw something about 70-plus countries.
That's right. Over 70 countries. They've accredited or certified, I think, over 1,000 programs.
Wow.
And they have this network of like 600 experts involved. So they really see what's happening globally.
That global perspective must be invaluable.
It really is. And what's striking is hearing from the hospitals themselves about the impact. We have some examples.
Great. Like.
Well, Hong Kong Adventist Hospital said the JCI process was one of their best team-building exercises ever.
Team building. That's not what you'd immediately think of.
I know, but it apparently forced better coordination, better communication between departments.
Huh. So it's not just about ticking boxes for an external body. The process itself improves things internally.
Exactly. And Burjeel Farha Hospital mentioned it gives them a clear competitive advantage.
Makes sense.
Plus, it boosts community trust, strengthens risk management. Emirates Specialty Hospital said something similar, added value, patient confidence.
And didn't Corniche Hospital mention getting accredited multiple times?
Yeah, 6 times.
Yeah.
Which really shows this isn't a one-and-done thing. It's about maintaining those high standards continuously.
Commitment.
Yeah, okay.
And the core of this evaluation, it comes down to JCI's own standards, right? And these patient safety goals.
That's the bedrock, yes. They developed these really rigorous international standards, including the International Patient Safety Goals. And that's what they use for the evaluation. The aim isn't just the certificate, it's about helping organizations measure, improve, constantly get better.
Continuous improvement. Got it. Now, let's shift geographically a bit. You mentioned NABH.
Right, the National Accreditation Board for Hospitals and Healthcare Providers.
And they're focused specifically within India.
Correct. NABH is part of the Quality Council of India. Their job is to set up and run accreditation programs for hospitals and providers across India.
Okay. And we saw a mention of Supreme Medic Consultancy.
Yeah, they're an example of a partner organization that actually helps hospitals navigate that NABH accreditation process.
It guides them through it.
Exactly, from planning right through to the final assessment, offering support.
So we have JCI globally, NABH in India, both setting these quality benchmarks. And it's interesting, the material on digital quality platforms specifically calls out both JCI and NABH when talking about compliance.
That's a really key link. It shows how these accreditation standards are directly feeding into the requirements for the digital tools hospitals are using.
The tech has to support the standards.
Precisely. And we should also mention ISQA here, the International Society for Quality in Healthcare.
Okay, what's their role? They sound important.
They are. They're global, nonprofit, been around over 30 years. Think of them as more focused on promoting quality improvement worldwide through education, sharing knowledge.
So less about setting the specific rules, more about fostering the community and sharing best practices.
Exactly that. Education, knowledge sharing, they do external evaluations too. Network across, again, over 70 countries. It really underlines this global push for better quality.
So putting it all together, JCI and ABH, setting standards, ISQA, fostering collaboration, it's all pushing towards safer, better healthcare.
Right, which leads to the big question.
Yeah.
How do hospitals actually manage all this day to day?
Yeah.
And that, is where these digital quality platforms really enter the picture.
Okay, perfect transition. Let's dig into these DQPs. What exactly are they? Break it down for us.
Okay, so think of DQPs as specialized software systems, often cloud-based.
Right.
Their whole purpose is to help healthcare organizations manage, track, and ultimately improve the quality of care.
And a key part is integration, you mentioned, connecting with other systems.
Yes, that's crucial. They often tie into the hospital's main electronic health record, the EHR, maybe lab systems, pharmacy systems, pulling data from various places.
That brings all that quality-related info together. What can these platforms actually do? What are the features?
Several key things. First, data aggregation, pulling that data in from patient records, surveys, feedback forms, you name it.
Okay.
Second, analytics and reporting. They can crunch the numbers and create detailed reports, dashboards, visualizations of quality indicators.
See how you're doing at a glance.
Exactly. Third, benchmarking is often a feature. Comparing your performance against industry standards or, similar hospitals.
See where you're saying.
Right. And finally, continuous monitoring. Real-time data feeds let you spot trends or problems almost as they happen, not weeks later.
That sounds way more efficient than, manually compiling reports. Fewer errors, too, I imagine.
Oh, definitely. That's a major benefit. Improved efficiency and accuracy. Automating data collection reduces errors, streamlines workflows.
Okay.
Then there's the real-time data access. Staff aren't waiting for a monthly report. They can see performance now.
Which allows for quicker decisions.
Exactly. Yeah. Better data-driven decision-making. Using current info, trends to adjust care protocols or allocate resources.
And patient safety, how do they help there?
Big impact. By closely tracking things like infection rates, medication errors, patient falls, you can intervene much faster.
Proactive rather than reactive.
That's the goal. And finally, compliance. We touched on this. They help ensure you're meeting those NABH or JCI standards, with audit trails and protocol tracking built in.
Okay, so if a hospital's thinking, we need one of these, what should they look for? What makes a good DQP?
Good question. Integration is top of the list. It has to connect smoothly with existing systems, EHR, LIS for labs, RIS for radiology.
Avoid data silos.
Absolutely. Customizable dashboards and reports are key too. Different staff need to see different things, so flexibility matters.
Tailor it to the user.
Right. Benchmarking capabilities are valuable, as we said, and increasingly integrating patient-reported outcomes, or PROMs.
Capturing the patient's own perspective.
Yes, getting direct feedback on their experience and outcomes. And maybe most basic, but critical, it needs to be user-friendly. Easy for busy staff to actually use.
Can't be clunky or complicated.
Or people just won't use it no matter how powerful it is.
Right. It sounds like these are becoming really sophisticated tools for driving change. Do we have examples of how they're being used, like specific cases?
We do, yeah. Case studies really help illustrate this. Let's take Hospital X, a large hospital. They used a DQP focused on infection control.
Okay, a common challenge.
Very. By integrating EHR and lab data, they got real-time tracking of infection rates by unit.
So they could see hotspots.
Exactly. Identify patterns, see where protocols maybe weren't being followed. And the result? A 20% drop in hospital-acquired infections in 1 year.
20%? That's huge. That saves lives, saves money.
Absolutely. Then there's Clinic Y. They use their DQP to analyze patient satisfaction surveys, PROMS data.
Focusing on the patient experience.
By monitoring that feedback constantly, they found specific areas needing improvement, made changes, and saw a 15% jump in patient satisfaction scores in 6 months.
Wow. Again, really tangible results from focusing on the data.
It shows that listening to the patient voice digitally can drive real improvements.
Definitely. And one more.
Hospital Z. Their main goal was JCI and NABH compliance.
Okay, the regulatory angle.
Right. They configured the DQP to track adherence to protocols, training, safety initiatives. It had automated alerts for any deviations.
So it flags problems automatically.
Yep, which helped them stay compliant, improve their accreditation readiness, and manage risks proactively.
These examples really show the practical power of DQPs across different areas: infections, patient satisfaction, compliance.
Exactly. They make the benefits much clearer.
Okay, so we focused on DQPs. But how do they fit into the, bigger world of digital health? Are they separate or part of something larger?
That's a great question. It's best to think of DQPs as a really important part of the broader digital health platform ecosystem.
Okay, so DQPs are a specialized tool within a bigger toolkit.
You could say that. These broader digital health platforms aim to integrate lots of different digital tools, EHRs, patient portals, telemedicine, wearables, AI analytics into a more cohesive system.
Like a central hub for everything digital in healthcare delivery.
Kind of, yeah. Leveraging cloud, big data, AI, IoT, all that tech.
Yeah.
The goal is often about centralizing data management, improving patient engagement.
Through things like portals or apps.
Right, and using AI for better clinical decisions, streamlining operations, making care more personalized, and improving access through things like telehealth.
So a much wider scope than just quality metrics.
Much wider. We're talking EHRs themselves, patient portals, telemedicine platforms, wearables, mobile apps, AI tools, chatbots. It's a big landscape.
Got it. So within that landscape, what's the specific role of the DQP again?
DQPs keep their core focus on quality. Data aggregation for quality, managing quality metrics, benchmarking against standards like HADES, NEBH, NEQF, QCI.
Those acronyms again. Quality indicators.
Exactly. Using dashboards for quality visualization, using AI for predictive quality insights, integrating workflows to improve quality. The focus remains quality, but within that larger digital environment.
And you mentioned some specific platforms earlier, Cerner, Epic, Health Catalyst.
Yeah.
How do they fit?
Well, many big players like Cerner and Epic offer comprehensive suites. They are broad digital health platforms that include strong DQP functionalities.
Okay, so it's built in for them.
Often, yes. Others like Health Catalyst might have a stronger historical focus specifically on the data warehousing and analytics piece for quality and population health. Then you have initiatives like NHA's Hope in India aiming for unified health records, or companies like Queer.ai using AI in imaging for diagnostic quality. Prisma from the WHO focuses on safety event analysis, different angles.
So lots of variation depending on the platform's focus and the context it's used in.
Definitely.
What kind of specific metrics are these DQPs tracking day to day? Give us some examples.
Sure. Clinically, it's often infection rates, readmissions, surgical site infections, mortality rates. Operationally, things like bed occupancy, test turnaround times, appointment no-shows.
Patient side.
Patient satisfaction scores, net promoter score, those PROMs we mentioned, patient-reported outcomes. And safety-wise, near-miss reports, medication errors, falls, a whole range.
That's a lot of data points. What tech makes it all possible? You mentioned AI.
Yeah, AI and machine learning are huge for predictive stuff. Natural language processing, NLP, helps analyze text notes.
Like doctor's notes.
Exactly. Data standards like FHIR and HL7 are crucial for getting systems to talk to each other, interoperability. Blockchain is being looked at for security. Robotic process automation, RPA, can automate data entry. And IoT, the Internet of Things, connects devices for real-time monitoring.
It's really a convergence of several advanced technologies.
It has to be to handle that complexity and volume of data effectively.
So, boiling it down, what are the main wins for a hospital that implements a good DQP system?
Okay, key benefits. Real-time surveillance, knowing what's happening now. Data-driven governance, making informed decisions based on evidence. Lower medico-legal risk spotting and fixing safety issues sooner. Improved accreditation readiness, being constantly prepared for surveys. And fostering that culture of continuous improvement we talked about.
Sounds pretty compelling. What's the journey like for a hospital wanting to put one in place? Is it complex?
It's definitely a significant undertaking. It usually starts with assessment, understanding their needs, existing tech, goals.
Figure out where they are.
Right. Then platform selection, choosing the right fit, considering interoperability, scalability. Then the big one, data integration, getting it all connected.
The plumbing.
Pretty much. Followed by training staff, managing the change. And it's not install and forget. It needs ongoing improvement cycles, strong governance involving clinical, quality IT leaders.
A continuous process, not a one-off project.
Exactly.
You mentioned some global examples earlier beyond single hospitals.
Yeah.
What can we learn from those bigger initiatives?
Yeah, looking at national or large system efforts is useful. The NHS in the UK, for instance, uses digital platforms via NHS Digital and Quality Watch to track harm and improve transparency.
Okay.
Apollo hospitals in India used a clinical intelligence platform, saw real reductions in mortality, less variation in practice.
Impressive.
Intermountain Healthcare in the U.S. reported major cost savings from quality projects driven by their digital platform. And Aravind Eye Care in India scaled up surgical volume massively while maintaining quality using their own digital system.
So it proves the model can work at scale, not just in individual hospitals.
Absolutely. It shows the potential for system-wide transformation.
And looking ahead, what's next for DQPs?
It's moving fast. We'll likely see more integration with ESG metrics, environmental, social governance for sustainability, more use of voice AI, maybe analyzing patient-doctor conversations for quality insights, quality as a service models, making these tools accessible to smaller players.
Like a subscription?
Possibly. And even global benchmarks for medical tourism driven by quality data.
It really does sound like a field that's constantly innovating.
Definitely. Which, brings us back to where we started.
Yeah, that connection between the standards, JCI, NABH, and the tech, the DQPs.
They're not separate things anymore. The standards set the goals, and the digital platforms provide the tools to measure, manage, and achieve those goals much more effectively. They really work together.
They're intertwined, and organizations like ISQA are helping foster that global conversation around it all.
Exactly. It's all part of this larger global shift towards care that's safer, more effective, and importantly, more patient-centered.
It's a fundamental change in how quality is managed.
It really is. And maybe that leaves us with a final thought for you, the listener.
Go for it.
As healthcare keeps changing so rapidly, how do you think this synergy, this link between global quality standards and these ever smarter digital tools will actually reshape how care is delivered in the future? And what's the role for continuous learning and adaptation, not just for doctors and nurses, but for patients too, in navigating this evolving landscape? Something to think about.
Definitely something to reflect on. How standards and tech together will change things for all of us. A great place to leave it.